You're listening to Fast Facts Perio Edition. And now, here's your host, Katrina Sanders.
Hello, and welcome to Fast Facts Perio Edition. This week, we're looking at a new research study issued by the Journal of Clinical Periodontology, where we're looking at the relationship between the carotid Intima-Media Thickness and periodontal disease. More specifically, they actually dissected this research down into populations of individuals in Japan with and without hypertension to begin to surmise or understand how periodontal disease can influence cardiovascular disease risk. So let's dial it back. Let's take a deep dive, shall we, into the innermost two layers of the arterial wall. That is what we call the Intima-Media. And these innermost two layers of the wall can actually get thicker. And so there is a marker called the Intima-Media Thickness marker. This is where we look for what's called subclinical atherosclerosis. So we evaluate this in symptomatic adults, and certainly patients with hypertension typically are evaluated for this marker, as it is a terrific predictor of at least moderate risk for cardiovascular disease. So this carotid Intima-Media Thickness test is essentially used to determine the extent or the thickness or the amount of plaque buildup residing within the walls of our arteries that are going to supply blood to the upper extremities. So, as you can imagine, an increased thickness of these inner layers of the carotid arteries are going to certainly be an indicator for cardiovascular risk, and more specifically, the fact that there is thickening leads us to question, are some of these plaques developed in kind because of the presence of periodontal disease? So a healthy thickness for a middle-aged healthy adult is anywhere between 0.6 to 0.7 millimeters. That is considered healthy. So if there is a test result that demonstrates a thickness of 1 millimeter or greater, that would indicate a elevated risk for cardiovascular disease. So what are some of the things that can cause thickness? Aging can cause thickness, high lipoprotein levels, so your high cholesterol, hypertension, tobacco status, diabetes, obesity, sedentary lifestyle. But you'll notice that periodontal disease is not listed as one of those common contributory risk factors associated with thickness. Well, in November of 2022, a large Japanese study was done to investigate this observation or this relationship. And as you might imagine, there was a positive correlation that was found between the Intima-Media Thickness score and periodontal disease. Meaning the more involved the periodontal disease, the thicker the IMT score. The conclusion of this study clarified that there is an association with periodontal disease and atherosclerosis. And interestingly enough, this association between periodontal disease and atherosclerotic disease was detected in both hypertensive participants as well as those who are considered normotensive or having a stable blood pressure reading. This data continues to corroborate some of the concerns that we do have about how plaques that form in the mouth and are undisturbed are subsequently able to enter the bloodstream and create potential risk or complications within our arterial walls. Well, that's all I have for this week. Stay tuned next week as we continue the conversation around quick facts and periodontitis. This has been another episode of Fast Facts Perio Edition with Katrina Sanders. Please feel free to reach me on Instagram at The Dental Wine Genist or on my website, www.katrinasanders.com. Cheers.